I'm the science guy, and I'm here to talk essentially about grains in health and how that relates to the American public. As Judy mentioned, the industry is constantly being challenged by diet books that pretty much bash carbohydrates in one form or another. And I'd like to start with just talking about the guidelines, the 2010 Dietary Guidelines, and what's in it for grains. Has that changed since the last guidelines were released? A little bit about opinions and something about science. If you read the Dietary Guidelines and focus on just what the guidelines have to say about grains, if you look under the heading Foods and Food Components to Reduce, you will see, and I quote on the slide here, the guidelines suggest that we should limit the consumption of foods that contain refined grains, especially refined grain foods that contain solid fats, added sugars, and sodium. That's basically the singular statement it makes about grains, or refined grains. Now, if you look at what the guidelines say about foods and nutrients to increase, consume at least half of all grains as whole grains, and increase whole grain intake by replacing refined grains with whole grains. So you look at this and you think that, well, they're obviously focusing on whole grains at the expense of refined. And I'll get back to that in a moment. I think there's obviously a happy medium that can be reached when you look at the actual practical guidelines here. They also touch on the glycemic index. Now, the glycemic index has been with us for a long time. It was originally developed back in the early 1980s, but it's really gained traction, I would say, in the last 10 years. There have been books on the glycemic index, the glycemic load, and a lot of science published on this topic with relation to body weight as well as health. The dietary guidelines have only one thing to say about glycemic index or glycemic load. Strong evidence shows that glycemic index or glycemic load are not associated with body weight. As such, they insist that it is not necessary to consider these measures when selecting carbohydrate foods and beverages for weight management. So basically, their assessment of the science is that we just don't know. It does not look like there's any association there. But I don't think they looked quite hard enough. Now, a few years ago, I published a paper in the Journal of the American Dietetic Association, which I reviewed all the pertinent literature on the relationship between carbohydrates, glycemic index, glycemic load, whole grains, refined grains, and body weight. If you look at all the published research on this, up through 2007, and the studies that have been published since then support this as well. With relation to glycemic index and body weight, all the major cohort studies that include 300,000 subjects, large studies. This is Nurses Health Study 1, Nurses Health Study 2, the Health Professionals Follow-Up Study, you name it, NHANES, all of these. When you look at glycemic index and the highest and the lowest quintiles, the groupings of glycemic index, the average BMI is about 25.9. in the lowest and about 25.5 at the highest. Now for BMI, if you convert this, most of these studies include women. One BMI unit is about 5 pounds. So what this suggests is that if anything, the trend for glycemic index suggests that as glycemic index goes up, body weight maybe trends down a bit. When you look at glycemic load, you see an even more compelling picture. The lowest grouping of glycemic index, or this should be glycemic load, I'm sorry, that GI there should be a GL. 26.1 and the highest about 25.2, nearly a 1 BMI unit difference. It's again about 5 pounds. So I should point out here, all of the studies show this trend. It's not like a mix. Every single one of the glycemic load studies show as glycemic load goes up, the body weight goes down. So this statement here that they are not associated with body weight is actually incorrect. If anything, it shows the inverse relationship. In other words, the higher the load, the lower the body weight. They have one more comment to make in terms of mixing grains and so forth, and that is choose foods that provide more potassium, fiber, calcium, vitamin D, which are nutrients of concern in the American diets. Those foods include vegetables, fruits, whole grains and milk products. So again, whole grains, again, is emphasized as something to increase. And the reason they emphasize this can be shown on this figure here. If you look at the foods on the top, eat more of these, you can see that whole grains right at the top, only 15% reach the recommended goal. Where if you look on the bottom, eat less of these, you see refined grains, it's about 200%. So even though grain consumption is high, I think the dietary guidelines are probably correct by saying we should try to get these closer together. And in fact, they provide some examples. So they recommend, on average for adults, 6 servings of grains per day. At the top, you can see 3 ounces of whole grains and 3 ounces of refined grains. In the middle, they have 2 whole, 2 mixed, and 2 refined. And at the bottom, they have 6 servings that are a mix of both whole and refined. So this suggests that the dietary guidelines is actually suggesting that Americans should probably have a mix of both. And the reason for that can be shown in this figure here, one reason for that. This is a study that was published just last year. It was the Framingham Heart Study, one of the more than 1,000 publications that have come out of this cohort. It was published in the American Journal of Clinical Nutrition. And what it did was looked at the cohort with respect to the reported refined grain, whole grain intake, and visceral adipose tissue. Now, this is the harmful belly fat that Dr. Davis refers to. And I'll get to his assertions in just a moment. But if you look at this, you can see there are various combinations. On the left-hand side, or your right-hand side, you see whole grain servings ranging from less than 0.2 to about 3. And you can see on the front axis, refined grains ranging from less than 1 in the front. And as you move left, you can see that it goes up to about 4 servings per day. The height of the bars indicates the actual volume of visceral adipose tissue. This is the gut fat we have, the internal abdominal fat that is around the internal organs and so forth. It comprises actually a fairly small amount of the total body fat, but nevertheless, it appears to be associated with almost all the health risks associated with obesity. Now, if you look at this, you see the lowest bar here is the one that is associated with about 3 servings per day of whole grains and about 2 servings per day of refined grains. The absolute worst is the less than 0.2 servings per day of whole grains in the back right. Now, I sent this article and highlighted this figure to a reporter for the Chicago Tribune, Monica Eng. And I sent this to her because she was doing this story on wheat belly and wanted our input. I sent this to her and I said, please look at figure 1. It shows quite clearly that those that have a lot of grain intake, particularly a mix of refined and whole, seem to be better off with regard to belly fat. And the worst situation is where individuals who avoid whole grains altogether. Now, Dr. Davis, the author of The Wheat Belly, contends that it doesn't matter if it's refined or whole. All whole grains are bad because they spike blood sugar. This causes insulin to be secreted, and insulin is lipogenic. You deposit more fat. His response to the Monica Eng was, I agree with this study, but eating my way will lower visceral abdominal fat even more. Now, this is based upon the results of several thousand people. He has a few anecdotal stories he talks about in his book. So I replied to Monica, look, I give you a peer-reviewed article published in the top nutrition journal in the world from a famous cohort. And he replies that his way can do more because of anecdotal evidence. Isn't this some sort of false equivalency we're set up here? He claims this, we claim this, and the truth must be somewhere in the middle? No, the truth is with us, period, because it is science that's supporting this. Now, to put this in perspective, and I always like to do these, I love these kinds of studies that are published. This was published in the New England Journal of Medicine just a couple months ago. Got a lot of media attention. Walter Willett was all over the media talking about this study. Changes in diet and lifestyle, long-term weight gain in men and women. Now, this may be hard to see from the back, but what this group of studies did, that included the Nurses' Health Study 1, Nurses' Health Study 2, and the Health Professionals Follow-Up Study, which was men. They looked at the relationships between changes in reported food intake and weight change every 4 years. Now at the top you see foods, bottom beverages. I want to focus on the foods. If you look at that first red box, you see it's refined grains. And you can see 3 little bars sticking out to the right. And those are represented by each of the studies, the Nurses' Health Study 1, 2, and the Health Professional Follow-Up Study. What this suggests, if you look down at the very bottom, is that increasing refined grain intake had the effect of increasing body weight over a 4-year period on order of about 0.39 pounds per 4 years. I'll get to this exact specifics in a moment. Down at the bottom, you can see whole grains had about the opposite effect. Fair enough. Most of the studies support this. But let's look at this from the perspective of what it actually means. Most people won't translate this of servings per day to pounds and so forth. What does that actually mean? Well, I did the calculations on this. 1 additional serving a day of refined grain was associated with 0.39 pound weight gain every 4 years. This is statistically significant. The question is it clinically relevant? 1 additional slice of bread, a serving, every 4 years equals about 1,460 slices of bread, or about 73 loaves of bread to gain about 1/3 of a pound. 1 pound over 4 years would require eating about 187 loaves of bread, or about 3,700 slices of bread. Do you really think the average American is going to be concerned about this? Probably not, put it this way. But when you put it in the perspective of Walter Willett saying something like, you eat more refined grain, you're going to get fat. Literally true. How much does it take? Probably a lot more than most people think. So when you look at this from the standpoint of grains, whole and refined, again, this comes from the average of a number of U.S. cohort studies, about 161,000 in all. Body mass index for the lowest quartile or quintile of whole grain intake versus the highest, 26.7 versus about 25.8. Whole grains, clearly, you have a decrease in body weight associated with increased whole grain intake on the order of about a BMI unit, which is probably about 5 pounds. Refined grain, again, cohort studies in the United States. This is 5 large cohort studies, about 150,000 participants in all. Here you see something different, but it's not all that compelling. Lowest refined grain intake versus highest refined grain intake, not all that much of a difference, about 0.3 of a body mass index unit, which is about 1.5 pounds to 2 pounds for extremes. What are the extremes? Here's a good example of this, the Iowa Women's Health Study, cohort study that's been going on for years and years. If you look at this, 4 servings per week of refined grains associated with a BMI of about 26.9, 30 servings a week, 27.1. So you have more than a 7-fold difference in refined grain intake, and all it translates to is about 0.2 of a BMI unit, again, which is about 1 pound. So that's a massive difference in terms of grain intake, refined grain intake, and the result on the scale is not all that compelling. Health Professionals Follow-Up Study. This is one that actually Walter Willett is a part of. 4.2 servings per week versus 30 servings a week. Again, about a 7-fold difference. And look at the big difference in body weight. Zip. Absolutely nothing. His own study shows that refined grain intake has no impact whatsoever on body weight. Yet, if he were here today, I'm sure he would tell you that refined grain intake is going to make you fat and unhealthy. So what about carbohydrates in general? All these studies here, I won't read them off to you, but you can see there are many of the largest cohort studies have been going on in the United States for some period of time. Every one shows an inverse relationship between carbohydrate intake and body mass index. So the Wheat Belly book, even though the focus is on wheat and grains in particular, it's really about carbs. It's a low-carb diet that he's advocating. The same with the South Beach diet that came before, and Atkins and the carbohydrate addicts diet and so forth. Whether they focus on one particular carb, whether it's sugar one time, refined grains, it doesn't matter. It's all about carbs, and they're all wrong. The science does not support that. Even when you look at sugar, another villain. All the studies show, not all, but most of the studies show even sugar correlates inversely with body weight. So in conclusion, what I'd like to say is that with regard to the dietary guidelines, grains, particularly whole grains, continue to be featured prominently in the guidelines. Even today, the research continues to support health and weight control benefits of whole grains. There's no, I think, disagreement there in the scientific community. Refined grain intake has a negligible association with body weight, even though you'll probably find a lot of dissension in the scientific community with regard to this conclusion. The facts actually support the point that refined grains probably don't affect body weight all that much. And the glycemic index is not supported by the 2010 dietary guidelines, even though the data seem to suggest that, if anything, a high glycemic index, high glycemic foods, contrary to popular opinion, even in the scientific community, seem to vary inversely with body weight. The more carbs you eat, generally, the thinner you are.